Good afternoon. Right, good afternoon. I'm not too sure. I think Dr. Nasri is not in yet, so we gotta wait for a while. Okay, yeah, okay, she's just in. Right, now it's 2:31. Thank you for joining us. Thank you, Zaki, for putting up this links, and also now is a live share in Facebook. And this is our session. I think this is the ninth. Is it the ninth session? Yeah. For how I do it session. So great. We have today Dr. Nasri going to tell us a little bit about Mini-Cex and case-based discussion in teaching and learning, and has been a very strong teaching learning method actually. Not just assessment, as well known for its Mini-Cex. I think Dr. Nasri, we don't need much introduction. He is our assessment expert now in our faculty. So great to have him, and we can have a discussion. So the floor, we have 1 hour session, and yeah, perhaps we will just start. Will that be okay for everybody?
Yes, Prof.
Yeah, great. This is a Zoom meeting, so at least there's some voices. Otherwise, we are speaking to a monitor as usual. Anyway, Dr. Nasri, the floor is yours, and we shall hopefully for a live fruitful discussion today, and yeah, sharing some experiences and theory session. Thank you, Nasri.
Thank you, Prof. Tong. Thank you, everyone, for those who are joining with my sharing session on how to implement the Mini-Cex and CBD at the institutions. So, basically, this is my content for today. Just briefly introduction to Wpba, what and why, and 3 main characteristics of Wpba, and then the difference between Mini-Cex and CBD, or CBD with the existing assessment method, such as modified long case and OSCE. And then last but not least, we go to our main topic, how to enhance feasibility of Mini-Cex and CBD in a teaching and learning method. So this is definition of WPBA, batch 1 week 2013. Anything that you test at the workplace, we can call it as a WPBA. And then I think why WPBA is a most adopted assessment method nowadays, because it's located at the highest Miller's pyramid at DAS. And usually people talk when they talk about WPBA, they will say about authentic environment compared to modified long case or short case. It is as the simulated environment. In other words, we ask our patients go to the level 10 HCTM, but for WPBA, you can do WPBA anywhere as long as occur at the workplace. And then when you when you want try to search and read about WPBA, you can search as a WPBA or WBA or WPA, because different authors from different region, they might use different term, but actually it carry the same meaning. This is example type of WPBA, and then this is example another type of WPBA by John Nasri. John Nasri is a founder of the WPBA, and then I highlight in yellow because this is what we always adopt a type of WPA, for example, Mini-Cex, DOTS, and CBD. Why people nowadays goes towards WPA? Because actually WPA is just observation of our routine encounters at the clinic, at work round, bedside teaching. Therefore, one of the most feasible in the setting of clinical training. And then, of course, in addition, one of the good in the WPA is the formative feedback, and then development of plan for remediation when it's needed. In terms of educational impact, when we talk about competence, usually we relate with what the student do at the workplace. Okay, rather than what they do in the control environment. Okay, this is example of WPBA assessment form adopted by the KKM. They already adopt WPBA assessment method, CBD, DOTS, and Mini-Cex, and 360 degrees feedback many years ago. When they introduced a contract approach for housemen, so they already adopt the WPBA. Okay, and then there are three characteristics of WPBA. The first one is feedback. Okay, if you any WPBA assessment method without feedback, definitely you cannot call it a workplace-based assessment, because WPBA must have feedback at the end of the session. It's whether you want to give written feedback or verbal feedback or both. The second one about WPBA is about flexibility. Flexibility. It's very flexible. You can do anytime, when, where, and who. And then you can ask your student to choose the assessors, or you give the assessors to the student. It's very flexible. Who can become an assessor? If you train, if they have properly been trained, full-time lecturer, part-time lecturer, master students, or nurses, for example, docs. If you train your nurses or master student, they also can become an assessor. Because if you have more than one WPBA methods, it's better for you to have a different examiners, not similar examiners, to improve inter-rater reliability. Where can be accessed? Anywhere lah, inpatient, outpatient, ED, OT, on call. You can do it for CBD. You can do it online, because CBD just presentation, and then for Mini-Cex, for history taking, you can do online, because I believe nowadays in the clinics you adopt during the MCO, you adopt online consultation with your patient, so you can do online Mini-Cex or online CBD with your students. And then for docs, although there are a few argument, but there are authors or there are institutions adopt docs at the simulation base. Okay, not a real patient. Okay, you can do at dedicated time. For example, you give a proper schedule to the students when and where for the Mini-Cex assessment, or you can do at the clinic, bedside teaching, on call, work round, or after work round. Whether you want to make such an approach, for example, formal assessment. Formal assessment means you give a timetable to the student, schedule when and where, and you can set a number of WPBA per candidate, and lecturers also can set a case, place, date, and time. So usually, although you have your own schedule, but you still give open to the lecturer. For example, student A for Dr. Nasri on Thursday, but I myself as assessor, I can choose what time that I'm free. So it can be flexible to student and also flexible to the lecturers. Or you can approach as an unstructured approach, informal assessment. Student can approach their assessors or their supervisors anytime that they want to approach. You just set a minimum numbers of WBA per candidate. However, be careful with this approach, because I think we know that our undergraduate student usually they took a last minute approach, so it can become a burden to the supervisors or to the assessors, because most of them, if they be approached last minute, for example, in the final week of that posting, so it becomes trouble for the supervisors or assessors. And it is definitely not a single exam, because WBA, at the end of WBA session, you have a feedback, verbal and written feedback. How you want to ensure that student improve after the feedback? So you need to have another WPBA assessment session, not just based on a single exam. Okay. Now I go to Mini-Cex. Okay. So for content for Mini-Cex, this is content. I'm going to go one by one. This is a history of Mini-Cex. But what I want to show to all audience, I just want to highlight why they create the Mini-Cex, because they want to take a multiple snapshots of the student performance, and then they call it mini. What are the difference between Mini-Cex and modified long case or OSCE? The first row is a modified long case. Modified long case is unobserved. A student take a full case history and then physical examination, and then followed by case presentation, clinical judgment, management, and Q&A. But for Mini-Cex must be observed. And then student only take a focus history or focus physical examination. This is a minimum requirement. If the lecturer want the student to take a full history followed by physical examination, it's up to the lecturer. But what I want to highlight here is Mini-Cex is just a mini. It's a focus history or focus physical examination followed by the case presentation and then clinical judgment, management, and Q&A. And then last but not least, closed by immediate feedback. And Mini-Cex also not just focus on history and physical examinations. Mini-Cex also can be focused on communication skill. I will show you further later, in the next slide. This is example of focus of Mini-Cex. It's taking from patient who are problem for abdominal pain, just history of presented illnesses, anything, and physical examination of system or part of body, for example, examinations of hand. So in other words, Mini-Cex is a focus history taking or focus physical examination, a minimum standard for Mini-Cex. Okay. This is the difference between Mini-Cex and OSCE. Both OSCE and Mini-Cex should be observed. Of course, they are observed. However, OSCE only have minimal standardized Q&A, maybe 1 or 2 or 3 questions, because and then OSCE got comprehensive OSCE checklist. But compared to Mini-Cex have unlimited unstandardized Q&A. Depend on the assessor free time. If the assessor in hurry, maybe a few question. But if the assessor got a lot of time, the assessor can ask any amount of questions, unstandardized questions. Okay. This is an example of Mini-Cex and OSCE. You can see the difference between Mini-Cex form and OSCE. Mini-Cex form, you only have one item for history taking, one item for physical examination skill. But for OSCE, on the right side, for physical examination, you have 6 items. Can you imagine how comprehensive of the OSCE physical examination? compared to the Mini-Cex examination. What are the difference between Mini-Cex and case presentation during bedside teaching and or case presentation at the clinic? Of course, case presentation at during bedside teaching and clinic is a teaching learning method. Mini-Cex assessment is an assessment, but I just want to show to the audience the difference between Mini-Cex with the case presentation. Case presentation usually is unobserved. You ask the student to take a full case history and physical examination. For at the clinic, you ask the student to clerk a patient outside the supervisor room. Or for the bedside teaching, the student might clerk the patient a few days before the bedside teaching session, and then during the day, the student will present their case. But for Mini-Cex, like I present just now, it is an observe, and then it's a focus history or focus physical examination. This is different between Mini-Cex and then case presentation. How to incorporate case presentation during clinic and bedside teaching as a Mini-Cex? First, when you incorporate case presentation as Mini-Cex, indirectly you change your teaching learning method into assessment. Okay. So you just focus on what I circle in red. You still allow the student to take full case history and physical examination without being observed. Student can do that. For example, for bedside teaching, they can clerk and perform physical examination without being observed, or if outside the clinic, they can clerk the patient taking. And then when they enter the clinic room, or when they present the case during the bedside teaching, they start with case presentation, and then you need to proceed with observe physical examination. Observe physical examination, and then you can continue with clinical judgment, management, and Q&A with a feedback. It's something like a modified long case. Student take a full case history and physical examination without being observed, and then they go to the examiner's room. They just give a case presentation, and then the examiners bring the student to see patient and then perform physical examination, and then go back to the room, and then they will discuss on clinical judgment, management, Q&A, and then feedback. Okay. So basically, this is what you can do if you want to incorporate case presentation as a Mini-Cex. And then please don't forget, last but not least, usually in the case presentation at the clinic or during the bedside teaching, you give a verbal feedback as in front of other students, not a group feedback. You give individual feedback, but in front of their colleagues. But if you want to transform case presentation as a Mini-Cex, at the end of the bedside teaching, or at the end of the clinics, you might want to have an individual session with the respective student, and then at that time you start to write in the Mini-Cex form, and then a written feedback. Okay, because we still want to maintain case presentation during clinics or during bedside teaching as a teaching learning method. We just include the Mini-Cex form and the written feedback at the end of the session, of the teaching and learning session. Okay. What else we can assess other than just focus on history taking and physical examination in Mini-Cex? Why I put this slide? Because I don't want our assessors to become rigid. Just want to zoom on physical examination or history taking. If without history taking, if without physical examination, you cannot do it. You cannot do Mini-Cex. No, actually it's wrong, because you can focus on others, especially on communication skill. But of course, if you focus on communication skill in Mini-Cex, there is no case presentation, no clinical judgment, no management, or maybe there are few Q&A. This is example. example of others in Mini-Cex. Others mean other than history taking or physical examination. Communication with other members, breaking bad news, educating patient about management, general advice to patient upon discharge, explanation to patient about tests, conflict resolution. You can see how flexible Mini-Cex. If you not just focus on history taking or physical examination. Okay. Then this is other example. Consent taking, written communication. You can ask the student to write a referral letter if you want to ask. And then interpretation of finding to superior. You can give a blood investigation and ask the student to present. And then management, writing a prescription, and then critical appraisal. So the take-home message for Mini-Cex actually is more feasible. Not just feasible, it's flexible and simpler compared to modified long case and OSCE. Why I put this take-home message? Because I want you to ensure that don't relate Mini-Cex with long case. Do not relate Mini-Cex with OSCE, because modified long case and OSCE is a comprehensive assessment. In terms of domain you want to assess, in terms of assessment form, is very comprehensive. You must treat Mini-Cex as a simple assessment, flexible, and therefore it become more feasible. In other words, we don't want assessor view Mini-Cex as a burden. It's just a mini clinical examination exercise. They call it exercise. Because it's just 15 to 20 minutes only. And then you can focus on focus history taking or focus physical examination. Or if you have not much time, you can assess other than taking history or physical examination. Even you can assess 2 students for each case. And the first student can take taking history. The second student can perform a physical examination. So you can cover 2 students. And of course, we use a simple form, right? Not a comprehensive form like a modified long case with a rubric, or like OSCE, a lot of items, a lot of checklists in the OSCE. Yeah? And then during the case presentation or discussion, if you do it at the clinic, you can treat your patient first and then ask the patient to go outside the room, and then you can start case presentation and discussion. You can do that with or without patient, so it will not disturb your clinic environment. Okay, and then for case presentation as a Mini-Cex, filling the assessment form and written feedback you can do at the end of the session. Not you don't have to hold the Mini-Cex form during the student present the case. If you do that, we want student to present a case at the clinic and during the bedside teaching, like a teaching learning method. In the safe environment, I call it safe because it's not assessment. And then you give a verbal feedback at the end. You allow other students to go back and then ask the respective student who present the case, sit down, and then you can fill the Mini-Cex form in front of the student. And if you want to save time, you can ask the student to write a written feedback. They need to recall your verbal feedback, and then they will confirm with you, and then the student can write a written feedback. In other words, they need to summarize your feedback, your verbal feedback, into a written feedback. You can do that. Okay. Any question just for Mini-Cex before I go to CBD? Because CBD and Mini-Cex is a different approach.
Yep. Anybody can, yep.
Assalamualaikum and good afternoon to Nasri. I just want to ask about the Mini-Cex. So if we opted for the focus physical examination, then there is a list of what we should do in the Mini-Cex form kan? Ada macam 6 ke berapa entah. So I can tick on the physical examination part, and then just choose
Ni saya
another
tunjuk.
part, is it? No need to do
Ni kan?
the rest of it.
Tadi bang?
Besar sikit.
Tadi bang?
Ya, dengar. Ya, yang ni lah.
Tak dengar tadi bang?
Dengar tak?
Muted. Now boleh dengar?
Sekarang dengar kan?
Dengar.
Okey. Tadi pun macam ni juga.
Ya.
Dr. Nasri punya speaker tu kot.
Kita dengar.
Tadi bang, I think I can answer your question. Kalau you tengok list of this Mini-Cex form ni, you nampak kat belah kanan sekali punya kolom dia tulis not observe.
Not observe.
Sebab
Yes.
itulah, sebab tu you boleh pilih mana satu je you nak access.
Okay.
So kalau you buat history taking without physical examination, you just tick
History taking lah.
not observe dekat physical examination. So you just focus on history taking and then maybe straight away go to the diagnosis and clinical judgment. That's why.
Okay. Itulah maksud saya, kalau yang the rest of it tu nak berapa?
In other words, walaupun ada banyak list kat sini, bukan nak kena buat semua.
Okay. So minimum?
Tapi bukan single item lah. Tak boleh lah single item kan. Okay lah, takkan buat history taking dah habis macam tu. Proceed lah with the diagnosis of clinical judgment. Kalau assessor tu terlalu nak cepat, mungkin just go to the diagnosis and differential diagnosis. Sebab tak sempat nak discuss on clinical judgment kan. So history taking with a clinical judgment or physical examination with a clinical judgment. Okay.
So maybe 2 or 3 cukup lah Dr. Nasri.
Dr. Nasri.
Oh, saya yang
itulah.
La ilaha illallah. Patut saya kata sorry tadi bang. Saya jawab soalan tu tadi bang.
Jawab dengan baik.
Jawapan dah ada dah.
Macam mana saya boleh tertekan ni?
Okay.
Cuma itulah. So pilih between 2 or 3 assessment dah cukup lah kan in that form kan?
Cukup.
Okay.
Sebenarnya yang ni masih dalam bentuk discussion ni. Saya nak propose a new, more user friendly.
Saya baru nak tanya Dr. Nasri about a simpler way of assessment, because you nak kira, times marking, weightage and everything. It make life complicated for the assessor. So if we can have a simplified Mini-Cex form, I think that would be really helpful.
So basically yang saya plan, saya nak buat macam ni lah. If I dah stick and then markah dia dah tak ada 0.75. Just 5, 4, 3, 2, 1. Macam ni je.
Yang ni cantik kot. Okay.
Kita endorse dekat mesyuarat MPP lah 5th of January tu. And then kita
Yes. I like this form.
Yes.
Okay, thank you.
Okay, now we go to the CBD. Nanti kalau ada apa-apa soalan pasal Mini-Cex apa-apa ke lepas CBD pun boleh tanya. Dia content untuk I punya CBD presentation. What is CBD? You nampak CBD pun walaupun dia tak ada perkataan mini CBD, dia tetap 15 to 20 minutes. Very short. And you tak boleh imagine nanti I tunjuk je beza CBD dengan long case kan. And then selalunya dia uses of medical record, tapi I personally letak dalam kurungan tu sebab we already agreed waktu bengkel pemunian assessment, we allow case report. Kita dah tak ada case write up, kita dah tukar pada case report as part of CBD sebab I tahu dalam case report tu you ada bagi markah, tapi you punya domain of assessment case report you tak jumpa student pun, you just bagi-bagi and then lepas tu ada yang bagi balik kat student, ada yang tak bagi balik kat student. And then since nowadays pun case report dah tak boleh guna turn in kan, sebab student undergrad tak cover, KM tak cover. So I think the best way we can utilize the case report as a CBD. Not just you boleh tanya student betul-betul untuk pastikan tu case dia, tapi you boleh assess from different perspective. Because nanti I tunjuk kenapa. And then CBD is based on what has happened. Not what would happen. You tak boleh letak perkataan if kat belakang. You tak boleh create another scenario to student. It's not fair. So kalau student tu ada contohnya IHD with comorbid diabetic, cukuplah yang tu. You tak boleh cakap if student have hypertension, if student have hypercholesterol, you tak boleh buat macam tu. You kena based on what happened to the patients. And then you nampak CBD dot number 4 tu, the trainees does most of the talking. Bukan kita, bukan kita. And then explaining what happened and why. And then of course the aim of CBD, kita nak understand the reasoning. They can write everything in dia punya case note ataupun dia punya case note yang official case report tu, ataupun dekat case note ataupun kat luar bilik masa kelak dekat klinik tu, tapi they need to justify why. This is the difference between CBD and modified long case. Modified long case, you tahu kan, dia unobserved. CBD pun unobserved. The bagus CBD compared to Mini-Cex ni, dia tak perlu observe. So itulah kelebihan CBD. Examiner tak ada komitmen nak berada with a patient and student. And then CBD sama dengan modified long case, student kena ambil full case history and student pun kena ambil full physical examination, sama dengan modified long case. Tapi dia ada beza yang saya highlight warna orange kan. First beza adalah student need to submit their written case. Dalam modified long case, dia tak submit, student pegang dia punya case tu. And then examiners suruh student to present. Tapi untuk CBD, student kena submit dia punya case note ke, dia punya case report ke. And then examiners, sebelum student present, examiner dah baca dah. Examiner dah ada target dah nak tanya soalan apa. Bukan start from scratch macam modified long case. Sebab tu dia boleh buat within 25 minutes. Sebab you dah tahu dah nak tanya apa, why. And then you nampak the last box yang warna orange tu. CBD dia bukan tanya why je. You kena test student other option. For example, student kata management dia nak bagi ubat A. You maybe want to test student, what about second medication? You want to test the student like that. Dia bukan end up dekat why. You kena test lagi. Kalau this option boleh tak? Kalau this option boleh tak? Okay. You bukan create patient punya problem, tapi you test student kalau ada different kind of management or safe management. This is CBD. Therefore, bila you tanya banyak why and other option tu, dah tak ada Q&A dah lah dalam CBD. Dia tak macam Mini-Cex, dia tak macam long case sebab you punya why and other option, that is Q&A. Okay. So the difference between CBD dengan case presentation pula, you nampak case presentation dia unobserved, sama juga case CBD tak unobserved, and then student present, and then you tanya why, and then ada Q&A. Tapi macam CBD I cakap tadi, yang warna orange, kotak orange, the third box and the fourth box, you kena pegang, you kena minta dulu. So kalau dekat klinik, you buka pintu, you dah kelak, bagi saya case note dulu. And then student tak payah masuk lagi, you baca-baca sikit, and then baru okay boleh masuk, and then present. Tapi kalaulah you boleh minta student to kelak patient dalam klinik, dalam your clinic room, been observed, you boleh buat lah. Of course susah lah sebab dia akan kacau you punya time, untuk waiting time untuk patient. That's why you boleh suruh patient, student kelak dekat luar. Bila kat dalam you baca dia punya case note dulu, bagi case note, you baca sikit, and then baru you allow student to present. Okay. Usually dalam CBD, student hanya present case summary je. Tapi kalau you tanya saya, case summary ni kalau yang case report, student tu dah prepare berhari-hari, dia dah tahu dah case apa. Kalau yang dekat klinik tu, fair enough lah, you sudah di present, buat case presentation yang longer case presentation lah. Sebab nak suruh dia summarize the case tu tak boleh dah kan, sebab case note tu dah ada dengan you. And then in CBD, you kalau student kata, Prof, boleh tak saya nak balik case note saya tu sebab saya lupa. Boleh. Sebab dekat klinik kan, dia baru kelak kat luar, mana sempat dia nak internalize, memorize semua kan. Dia tak macam case write up. Case write up tu dia buat berhari-hari kan, dia dah sebati dengan case write up tu. So kalau dia kata boleh saya nak tengok, you boleh bagi balik kat dia. Tapi you must look at the written case note tu dulu kan. So how to incorporate case presentation as a CBD? You tengok yang kat tengah tu. Okay, macam biasa, take a full case history, physical examination, tak payah observe. And then macam saya cakap tadi, student submit their written case or case note. Kalau dia tulis pasal pakai pen, tak apa. Dia nak sebab dia punya writing skill tu, kalau writing dia tak bagus pun, that one pun you boleh comment waktu CBD session. Sebab that one involve legality kan. You boleh highlight student the importance of tulisan tak cakap ayam kan. So benda-benda gitulah. That's the beauty of case-based discussion compared to the Mini-Cex. Sebab you boleh share you punya knowledge sampai level written, dia punya writing skill tu. And then that's how you want to, if you want to transform case presentation as a CBD. And then of course macam Mini-Cex tadi, lepas selalunya dalam klinik untuk ataupun dekat klinik ada 2 orang student. Kalau dekat basic teaching ada banyak student, you akan bagi verbal feedback, Q&A masa tu kan. And then bila dah habis tu, you allow other student balik. You mesti jumpa individual student, tak payah lama-lama pun sebab you dah bagi verbal feedback. You just keluarkan you punya CBD form, tick depan student. And then kalau you rasa student tu tak bagi masa you suruh dia tulis written feedback. Maksudnya dia kena summarize you punya verbal feedback. Tapi kalau you rasa dia pun macam lama makan masa, you tulis sendirilah you punya written feedback. In other words, kalau you nak transform you punya case presentation as a CBD ataupun as a Mini-Cex, you punya nak isi form tu buat last. Sebab dia tak nak ganggu you punya fokus. Sebab benda ni you dah biasa buat kan. Without form pun you dah tahu dah kat mana student tu punya silap. And then bila you dapat form at the end tu, you just recall kat mana. Sebab form CBD dengan form Mini-Cex dia tak complicated macam OSCE kan. OSCE ada banyak item. CBD kalau you taking satu row tu je for you to decide whether they get 4, 5, 3, 2, 1 kan. Yang I nak tunjuk you adalah gambar yang kedua dengan yang ketiga tu. CBD dia sepatutnya friendly macam ni lah. Dia bukan jauh-jauh macam long case kan. Seorang duduk kat ujung, seorang kat ujung. No. Very friendly. And then case note tu kalau you tak nak pegang, you boleh bagi kat student baju hijau tu biar dia pegang kan. Sebab you dah terbaca dah pun. Dia dah tahu nak tanya soalan apa kan. This is the approach of CBD. Dan CBD, kalau you ada masa, you boleh buat dekat specific room tu. Kalau tak ada, dekat mana-mana tempat yang suitable, nak in front of patient pun boleh. Tanpa patient pun boleh. Sebab bedside teaching kan biasanya nak buat sebelah patient. Kalau betul-betul original CBD tak buat depan patient, dia memang ada bilik khas. Tapi sebab kita nak incorporate bedside teaching, boleh buat depan patient. Cuma bila cuma berhati-hati bila discuss tu. Okay? Ni yang saya buat dalam bentuk written, yang saya cuma saya lupa. And then saya lupa nak cakap yang dalam warna merah ni, you nampak yang I buat warna merah case note tu, dalam kurungan tu including plan and future plan. So kalau student yang kelak patient dekat luar klinik, sebelum dia submit dia punya case note tu, dia kena tulis dia punya plan siap-siap. Sebab dia tak macam bedside teaching, dia tak macam case report. Case report memang dia dah ready dah sebab dia ada masa a few days kan. But for student who are clerking patient outside of the clinic room, you kena cakap tolong tulis you punya plan, investigation apa, definition diagnosis. Sebab we are going to discuss that one also. Sebab dekat klinik, sebab dia single encounter kan, you kena buat tu. Kalau takkan you nak just based on physical history taking je. So you must allow student to include their plan or future plan untuk ni. How to make CBD more feasible? Soalan ni saya nak jawab terus yang macam Dr. Adibah tanya tadi. Walaupun CBD form tu ada banyak row, you tak perlu pilih semua row. Kan? Sebab tu saya tunjuk you the difference between Mini-Cex and CBD with long case with OSCE. Sebab I nak cakap you, CBD and Mini-Cex dia tak comprehensive as OSCE as long case. you boleh pilih clinical encounter yang you nak lah. Nanti I akan tunjuk cadangan CBD form 2022 kat you all. Okay. And then jangan lupa saya tulis warna kuning, warna orange siap-siap dalam kotak tu. Student have to submit their written case or case note to the lecturer, and lecturer must review and plan based on candidate case note. Kalau case presentation, tak payah kita examine assessor ataupun supervisor just peluk tubuh, dengar and then tanya soalan kan. Tapi kalau CBD, diorang kena baca dulu untuk plan nak tanya soalan mana. Jadi that's why CBD is shorter compared to bedside teaching ataupun modified long case ataupun modified long case. Ni example yang kita punya kan, ada banyak tapi mungkinlah kesilapan saya tak cakap boleh pilih salah satu kan. Bukan salah satu, salah dua lah. Bukan satu item je, at least two kan. Tapi yang baru mungkin saya akan tunjuk. So the take home message for CBD is more feasible and simpler tapi not flexible. Kalau Mini-Cex flexible, Mini-Cex memang flexible, tapi CBD tak boleh letak perkataan flexible sebab dia memang kena follow, kena take history taking and then kena proceed with physical examination. Dia tak macam CX boleh pilih history taking, physical examination. Kalau tak nak dua-dua pun tak apa, boleh pergi pada communication skill. Tapi CBD is more feasible and simpler dan 15 to 20 minutes only. And then CBD, the actual CBD, kalau you guna case report ataupun case report ataupun work round punya, student cover back kan, you tak payah suruh dia present full macam long case. You just ask the student to present a case summary kan? Sebab dia orang dah ada dalam kepala dia orang present apa kan. Dia tak macam yang dekat klinik. Kat klinik tak boleh lah case summary, dia mungkin nak present semua kan. And then you can focus on clinical encounter mana you nak, choose two. And then macam saya cakap tadi, you can utilize student case report. Okay, kalau you nak test student on multiple encounters. Bagus ni you nak test on multiple encounters compared to single encounters. Sebab single encounters dekat klinik tu, student plan. Tapi multiple encounters, maksudnya student dah jumpa patient tu banyak hari, dia bukan buat future plan. Dia memang dia akan cakap apa dia nak buat hari ni, esok buat apa, kalau result datang ni buat apa. That's why kalau boleh CBD ni jangan fokus on klinik saja, sebab klinik is a single encounter. Kalau boleh fokus dekat walk round juga. That's why last week masa ada discussion dengan Dr. Norman, HOD dengan Prof. Husina, untuk yang kita nak buat RAP dekat ward tu, and then Prof. Husina panggil CBD, saya cakap kat Prof, jangan panggil tu CBD ya. CBD is an assessment. Kita panggil tu sebagai enhancing senior clerkship tu. Sebab enhancing senior clerkship boleh buat macam-macam. CBD is a part of assessment. So yang tu yang Prof. Husina tengah dah kita orang discuss dengan Fakulti Perubatan punya lawyer, macam mana nak design supaya kita boleh cover dari segi law. InsyaAllah kita akan go on that. And then bila you dah ada, student dah ada dia punya own rak tu akan berada dalam bilik seminar student dekat ward. Takkan ada dekat ward tu yang macam patient punya tu, sebab takut family datang, duduk tengok TV, dia ambil kan. Kita decided, lawyer pun cakap letak dalam bilik seminar yang ada kat setiap ward tu, biar duduk dalam tu, so lebih cover ada segi legality kan. And then CBD can be without the presence of patients. And then kalau you nak utilize case presentation as a CBD, macam sama juga, fill the form and then return feedback at the end sekali ya. Jangan pegang macam OSCE ke, macam long case, jangan. Sebab student dia nak treat case presentation dekat klinik dengan case presentation dekat bedside teaching as a teaching learning method. Kita nak student view CBD dengan Mini-Cex ni bukan because of assessment, because of feedback. Biar dia tahu, dia tak sabar nak dengar feedback. Bukan, apalah saya punya markah. Bukan. Kita nak, dia nak sangat doktor feedback saya apa. And then of course, our previous CBD and Mini-Cex form ada 2 pages. The second page tu adalah written feedback. Yang tu you pass to the student. Student akan letak dalam dia punya portfolio. Okay. And then as a conclusion untuk I punya session hari ni, I nak cakap about the authenticity of WPBA, Mini-Cex and CBD. Of course, sebab dia authentic, you cannot control the case complexity. So you jangan buat extra instruction pada assessor ke supervisor, pilihlah case yang tak payah pilihlah case yang apa, tak payah. Sebab it's a work-based assessment. Macam dekat family medicine, dia orang buat 3 Mini-Cex waktu dia punya posting 5 weeks. Kalau ditakdirkan hari tu banyak URTI lah student tu dapat. Nampak. So student can get as simple as URTI ataupun as complicated as, I tak tahu lah, you are define complicated tu kan. And then you cannot control the exam duration kan. Macam Mini-Cex dekat family medicine, tengah-tengah buat Mini-Cex, bunyi horn, bus, pon. So assessor terpaksalah cepat-cepat. So there is the authenticity of a WPBA. You cannot control that. But of course, you can control number of attempts. As long you letak dalam within 25 minutes, and then you are not testing everything using, and then you use a non-complicated assessment form, kita akan train, kita akan ubah mindset kita punya lecturers, clinicians, yang WPBA, Mini-Cex and CBD ni is not a burden, is not a complicated macam OSCE, macam modified long case. You can do that lah. Okay. I open to the questions.
Nak tanya pasal CBD tu kan. So the students kadang-kadang kan dia nak present kat kita tu, dia scribble. So kalau kita nak ambil notes dia tu macam payah lah kan. So maknanya lepas ni memang kena cakap kat students, treat every case as if it is your CBD.
Betul. Sebab masa walk round, masa dia orang jadi houseman pun, dia orang tak start dengan scribble kan.
Tak. Dia terus masuk notes. Okay. Alright.
Cuma kalau dekat klinik tu faham-faham kan, dia punya buku nota tu ada yang saiz lebih kecil daripada A4, faham-faham lah. Okay, thanks Nasri. So maksudnya wajib lah kita tengok written plan of the students. Yes. So you boleh fokus question kan, cepat-cepat. Tak adalah nak tanya semua benda.
Okay.
Dr. Nasri, any attempt to simplify the form? Oh yes, okay.
Yang ni I tak discuss dekat dengan Dr. Norman dengan Prof. Rosina. Yang Mini-Cex ada discuss. Tapi yang ni lah I cadangkan. Tapi I dah bagi to a few ketua modul, termasuk internal medicine. Maybe you want to suggest, sebab CBD ni dia lain sikit, tapi I nak buat macam ni lah kan.
Tapi I dah tengok form ni. My comment is kita tak payah assess professionalism 2 kali, because you assess sekali kat part A, you assess again in part B.
Okay.
So perhaps 1 is enough. Okay. And I'm quite happy. I mean, like, this form is quite simple lah, and then easy rather than you put a weightage. So yep. It's just that my comment is the professionalism dekat dua part tu je lah. Perhaps just 1 part.
Perhaps dekat part B lah kot
Betul.
Yes. So markah dia kena berubah sikit lah.
So kalau Dr. Nasri boleh bagi CBD dengan Mini-Cex, maybe kita boleh discuss kat dekat jabatan ke, and then nanti maybe boleh lah.
Because you want to make it standardized for all kan? This will be standardized kan?
Ya, tapi maksud saya bila kita dah ada suggestion dari peringkat jabatan, maknanya nanti masa 5 Januari tu kita boleh lah, okay, so this is the form.
Okay. Saya pass kat you juga. Cakap kat jabatan, kalau ada cadangan, kita tetap at the end kita akan standardize lah.
Thanks.
Welcome.
Yep.
Macam PITS kan, saya macam psychiatry, saya nampak dia ada tambah 1 pasal mental state. Saya allow lah Prof. Tuki buat macam tu. Mungkin macam PITS kan, you punya Mini-Cex kan, takut-takut lah you nak masukkan developmental assessment ke bond ke, you bolehlah tambah another row tu, tapi kau the main.
Okay.
Ada soalan lain? Ya.
Assalamualaikum Dr. Nasri. Sorry sebab saya nak tanya sikit berkenaan tahun 5 yang berkenaan student kena tulis macam another medical record kan for all patients tu, tapi untuk medical ada few issues yang kena bincang jugalah. Number one is because patient memang ramai, turnover memang tinggi. Dan I don't think supervisor will be able to review all notes because we already have the real notes and then kita kena tengok student notes pula kan. So kalau boleh dikurangkan lah macam satu student tu mungkin you just buat 1 or 2 ke for the supervisors to see.
Yang ni senior clerkship ke?
Senior clerkship tu.
Oh, sebenarnya kita tak wajibkan supervisor tengok semua.
Tapi
dia adalah
orang boleh buat juga tapi
familiarize dengan houseman punya approach.
Can but the papers are from faculty lah kan, because I don't want them to
Betul.
And the other thing is we really have to make sure that they keep confidentiality lah of the files and the medical records.
Yang tu kita dah discuss dengan fakulti lawyer and dia dah cadang beberapa perkara. Salah satu cara benda yang dia cadang tu yang kita agree adalah rak tu tak berada dekat ward, dia ada dalam bilik seminar student and then of course paper tu akan ada chalk. It's just for educational semua tu lah.
So okay, alright, fine. Because and lagi satu, kalau nak pakai trolley tu, we also have to think about sanitizing the trolley and all that, because I think the staff nurses have their own, a lot of job doing, sanitize the curtain lah apa, nanti nak kena tambah sanitizing the trolley and all that. So there are other things that we need to consider lah, because the number of the patients are very high.
Saya rasa kalau kita letak tu dalam bilik seminar, you panggil bilik seminar, bilik mesyuarat, lupa dah. Yang tu kita automatic assign ketua grup untuk pastikan tu sanitize lah. Kita sediakan alat dia lah. Okay. Cuma kita juga mencadangkan macam bankis yang makan kelembau ni kan ada kita punya alumni cadangkan supaya ada dalam seminggu tu ada satu hari khas untuk student, buat walk round untuk student. Jadi
sebenarnya ada, memang hari-hari kita round pun kita panggil dia orang present, tapi dia orang menyorok kat belakang. So we are very fast lah. Dia menyorok kita tak adalah pucuk-pucuk. So it's actually ada.
Dr. Nasri, it's not about doing rounds one day in a week. They're supposed to do round because they are senior clerkship. They are scheduling house officer. They should do their own rounds every morning when they are in the ward. So to just have one day dedicated day, for me it's sesuai kot. Let them to do it daily unless they have something in the morning lah. They have lectures ke apa ke. But if they are in the ward, they are supposed to do rounds and do their own round, write in their own case note. I think that will be more appropriate.
Yang tu memang dia orang buat. Cuma dia orang nak ambil pengalaman, mungkin dia orang nak ambil pengalaman yang rasa berdebar, bin school ke apa-apa, saya tak tahu term apa. Yang you kata yang siapa nak present datang depan, yang tu of course student sampai bila tak akan datang ke depan. Tapi maybe ada satu hari you tak buat walk round untuk 40 beg tu. You just Nasri, you cover beg apa? Okay, present. Cukup hari tu Nasri je. Tapi next week student lain pula. Bukanlah betul-betul walk round nak cover semua beg, tapi at least dia orang tahulah kalau dia orang akan duduk kat belakang waktu real walk round, akan ada satu walk round yang dia orang kena present juga.
Tapi Nasri, is the teaching learning for the walk round kan is extra from CBD kan? Is extra fit from CBD. So yeah, that's implementation of teaching. I think it's up to the department how to do it. I guess last time we had to is that we all have our own case and lecturer just go around and go, whose patient is this? And then that particular student have to present. Something like that. I'm not doing a walk round for so long, but I guess probably something.
Yang buat approach macam tu kan, after finish walk round, that supervisor akan pusing je, dia pilih je mana-mana. Sama I pun dah macam tu dah berdoa dah supaya tak kena kan.
But Dr. Nasri, I have one question. Since we are focusing a different thing in Mini-Cex, for example, some were doing history, some will do physics examination. Is there a need to coordinate so that, after the end of the Mini-Cex, a few multiple, we kind of comprehensively covered the domain. So the assessment for patients become a little bit more not too imbalanced, some would just get, how do you answer that?
Dia ada dua cara, Prof. Cara yang pertama adalah macam yang Fail Medicine buat. Sebelum student encounter dia punya second Mini-Cex, selalunya assessor tu akan tanya your first Mini-Cex, you dapat case apa and then you cover apa. Kalau dia kata I punya history taking and then the second Mini-Cex they go for physical examination. That is the first approach. The second approach, kita boleh create a table dalam logbook yang tak ada markah. Just student tick dia punya Mini-Cex 1, dia cover history taking ataupun others. So kalau examiner tu malas nak tanya, dia minta logbook, dia akan tengok oh dia dah buat physical examination. The second Mini-Cex is for history taking, something like that. We can do that.
Any other question? It's more like a challenges in implementing it in the final year.
Ada issue is I lupa nak tambah pelupusan rekod tu macam mana ya?
Okay, yang tu pun been discussed by the discussion hari Jumaat baru ni, and then bila patient tu dah discharge, student yang in charge patient tu akan ambil dia punya case note. Case note dia pun case note yang dalam bilik mesyuarat tu, dan dia akan bawa balik ke bilik. Dia orang disediakan satu file khas untuk physical portfolio.
Okay, because department punya shredder machine memang dah lama rosak lah.
Tak ada. Kita tak
kena beli shredder machine sendiri.
Dia akan discuss untuk letak sebagai department individual portfolio, and then maybe in future kalau kita saja nak getak student bawa portfolio batang sini nak tengok, takut lah kan. Kita
yes, ada proper ni lah. I just worried juga lah.
Betul.
I think the nursing also has got, then Dr. Hati is here. The nursing students also, they have their record. Apa tu? Nursing care plan record. Dia macam case note juga yang log, is that true? And that can also be used as case-based discussion.
Is it nursing process? I think so.
Yes, nursing process.
Nursing process. I have question, Prof. Tong. Just now I wrote in chat.
Oh, sorry, I didn't see the chat.
Whether Mini-Cex can use for summative tak, Dr. Nasri? Tak boleh?
Tak boleh.
Oh, okay.
For summative kena tembak lah. Kita discuss tentang dari segi how to maintain case complexity dengan student dapat case apa tu pun dah susah kan. Jadi dia akan disturb reliability and validity.
Prof. Razif, ada soalan?
Yes, thank you, Prof. Tong and Dr. Nasri. This is a lot of new term to me. Okay, it's not so much question. I think more on comment. I think what you have done is good. I mean, looks nampak macam kita panggil apa? Well structured assessment, which is good. And from the discussion I heard, you keep on improving in terms of assessment, which is very good. Cumanya my feedback from people with a surgical base is we are not very familiar dengan a lot of terms here. So I think you have a good what we say a good system, a good assessment. Tapi kalau katakan it's not really taken up by pensyarah, I mean I must say that a lot of pensyarah ni dia tak faham sangat benda ni. I think Prof Tong understand this. It won't carry your nilai murni ni. I mean it's very good. The way I look at it is you try to simplify for the assessment, which is very good. Tapi I think I must say that there are a few things that confuse. So my suggestion is number one, I'm sure you thought about this. It depends on the department, as you mentioned, whether they nak use CBD ke, you nak use Mini-Cex ke kan, and depends on the posting lah. Maybe the short posting tu tak perlu banyak sangat lah. Which I think at the moment saya nampak tu yang berlaku pada our department lah, which is kita tak diburdenkan dengan banyak this sort of assessment. So targeted a few comprehensive assessment is better than kita buat semua. And number two is kalau orang pun tak tahu macam mana nak carry on the assessment, I think pun dia tak cantik jugalah. Dr. Nasri, Prof Tong, thank you.
Betul. Yeah.
Saya nak respon pada Prof Razif. Jadi memang Prof, kita akan buat written guideline lepas ni.
Good.
Then kalau Prof kata dari segi better focus on comprehensive assessment compare to assessment yang simple-simple tapi banyak. Kalau Prof tanya saya, comprehensive assessment soalnya kita buat as summative assessment. And then it's just a cross-sectional punya assessment. and then kita tak ada feedback session masa tu, Prof. So student pun nak macam baru ni masa last week punya final pro, student contact Prof Sina direct, Prof saya nak feedback from the examiners. Tapi Prof kata, oh nanti dulu. Ni bukan assessment yang macam Mini-Cex yang boleh dapat immediate feedback sebab dia nak tahu. Cuma that's the beauty of this kind of assessment, is simple and then boleh bagi immediate feedback.
Yeah. But just to add on, Dr. Nasri and Prof Razif, actually, correct me if I'm wrong, Dr. Nasri, the workplace-based assessment is developed more towards postgraduate. And then undergraduate will adopt it if I correctly identify the story. Therefore, Prof Razif, I think postgraduate will have a lot of place for workplace-based and Mini-Cex and CBD. And the chances of summative and formative become interesting is that if a patient go through many formative assessment, they are almost ready for summative, 100% passes. So summative is good in standardization, but they also have validity problem. I mean, that's a validity because they cannot comprehensively sample every single thing in the shortest time. And so formative become very attractive, like, you know, Mini-Cex and case space, very attractive to cover all those little holes, right? So breaking bad news, sometimes it happens and sometimes it does not. So yeah, both, and it can be quite interesting. Think about it for postgraduate. Probably you're right. You know, it has to be objective driven, as you're right. Say ENT, a shorter posting. This is probably not a valid assessment.
Memang ENT daripada dulu lagi guna Mini-Cex je, Prof.
Oh, okay. Great. Fantastic.
Hanya kadang-kadang dia just focus on otoscopy je.
Betul.
Otoscopy is a bedside investigation kan, bedside physical examination, just focus on that.
Itulah saya tengok banyak ni saya jadi risau takkan kena tambah lagi.
ENT memang dari dulu memang satu.
Takkan banyak.
Pioneer sama dengan family medicine. ENT more family medicine. Cuma Prof Tong, sebenarnya work-based assessment is not belong to postgraduate.
Oh, okay.
Belong to postgraduate.
CBD.
Yes. Sebab work-based assessment kan ada banyak. Even logbook, zaman kita pun dah ada logbook. So, cuma CBD itulah sinonim dengan postgraduate sebab the discussion during CBD is very focused kan. That's why kita try CBD in year 3, ada supervisor kata nampak macam not suitable CBD for year 3. Better go for year 5. So, we will improve on that lah.
Alright.
It's just a mini, I believe, for undergraduate post okay. Sebab the spirit of work-based assessment is feedback. Bukan assessment approach tu. Dia lebih pada feedback. Sebab tu bila I tanya Prof John Nosini masa I pergi workshop dekat IMU, dia kata, Nasri, the spirit of work-based assessment is a feedback. You must have as many as you can WBA you can do. Sebab the aim is not about the marks. The aim is about the feedback. Sebab tu kalau you try Google Mini-Cex form dan CBD form Western country, dia orang tak ada numbers dalam form dia. Dia just ada tick. Sebab dia memang treat work-based assessment form ni as a formative assessment, pure formative. Tak ada calculate. Tapi sebab kita nak adopt as a continuous assessment, serampang dua mata, so that's why kita masukkan number dekat situ lah sebab kita nak ambil markah sikit.
Right. Any other issues, implementation issues, and incorporating teaching? That's the feedback, isn't it? That's what Dr. Nasri, we were in a workshop talking about this, and okay. Oh, Zaki said QR code will be there. Dipaparkan di hujung sesi. I think you can paparkan QR code, Zaki. You can paparkan QR code. Maybe Nasri can stop sharing. While doing that, any other question that we can ask? I think now it's 3:34. We promise 1 hour so that other people may have other agenda on. So please move on if you need to leave the discussion. We're probably going to close within 3 minutes or so. Yeah.
I akan pass my slide dekat grup Prasiswaza.
Yeah. Nak pass kat postgrad juga.
Ya, boleh mana-mana.
Dr. Nasri, would you share the slide or
Yes.
Okay, all right. Okay, thank you.
Thanks very much, Dr. Nasri and Prof Tong. Very helpful session.
Yeah, we'll have more. For those who are here, how I do this session is every once a month, and various discussion topic on teaching and learning can be focused here. So anybody would like to present theirs, you are most welcome. And Nasri has offered to come in. That's why we have this session today to share. And because many of us are doing many innovation in some way on teaching and learning. So sharing with a colleague would be great. Right. Yep. Right. With that, we conclude the session. Nasri, Dr. Nasri, thank you very much for your sharing, and we'll have more light discussion, future, hopefully. Right, thank you very much, everybody.
Thank you.
Have a nice day.
Thank you.